So today we have physiology of the blood. So total blood volume is made from 6 to 8%. It is called out of body weight and it is called normal volemia. If total blood volume makes less than 6%, it is called hypovolemia. If total blood volume is make up more than 8%, it is called hypervolemia. The main components of the blood are blood plasma, which is make up 56%, and formed element of the blood, which are make 45%. So blood plasma is composed of water. It is the main ingredient. 91%, 7% make up plasma proteins, and 2% other salts. Plasma proteins include albumins, globulins, fibrinogen, and other salts. They include ions, nutrients, waste products, gases, and regulatory substances. Formed elements of the blood. So the 99%, even more, is formed by erythrocytes or red blood cells, and it is referred to hematocrit, the percentage of the red blood cells. And less than 1% is for platelets and leukocytes, which make the buffy coat over the hematocrit. Hematocrit is the percentage of erythrocytes in the total blood volume. It ranges from 40 to 48%, an average 44%. And normal hematocrit is in the normal ranges is called normocythemia. If hematocrit is less than normal range, it will be oligocythemia. If it is more than normal range, so it will be polycythemia. Main functions of the blood include respiratory, trophic, excretory, thermoregulation, integrative, and regulatory protective. Respiratory is mainly provided by erythrocytes and by hemoglobin. So hemoglobin carry oxygen and carbon dioxide from the tissues to the lungs, from the lungs to the tissues. Trophic function realized by the transporting of the useful nutrients to the tissues. Excretory function, so transport of the waste products to the excretory organs. Thermoregulation, carrying of the heat from the organs which have greater heat production to the organs which has less temperature, and also carrying of the heat to the periphery to provide heat removement when it is necessary. Integrative and regulatory, so many humoral substances activation is occur in the blood, and also blood transport many humoral factors. Protective is provided mainly by the leukocytes, which provide immune response. Common plasma protein makes from 68 to 87 grams per liter, albumins 35-52 grams per liter, globulins 20-35 grams per liter, fibrinogen from 2 to 4 grams per liter, albumin globulin coefficient 1.3 to 2.2. So albumin is mainly responsible for the oncotic pressure. Oncotic pressure is important to maintain the water fluid in the vessels and prevent fluid movement from the vessels to the tissues. Plastic function, so the albumin as the greatest representative of the plasma albumin, plasma proteins. It forms reserves of amino acids for protein synthesis. Also, due to the presence of negative charge on the surface, it is responsible for maintenance of colloid plasma stability and suspension properties of the blood. And also, it is involved in transport of bilirubin, steroid hormones, thyroxine, calcium ions, sulfanilamide, and penicillin. Globulins include three fractions, so it's alpha globulins, beta globulins, gamma globulins. Alpha globulins are glycoproteins. 2/3 of all blood glucose circulates in form of glycoproteins. Also, it includes responsible for transport of the hormones, vitamins, microelements. Contains number of proteolytic enzyme inhibitors, prothrombin, one of the blood clotting factor, and angiotensinogen. Beta globulins are plasma proteins fraction that transport 75% of all plasma lipids. Protein transferrin, which is transport form of iron. Most of the complement system proteins, blood clotting factors, and GABA globulins called immunoglobulins, since this fraction includes antibodies. Fibrinogen is the main protein responsible for the blood clotting. Next component of the blood plasma electrolytes. They are represented by the sodium, potassium, calcium, and other electrolytes. So mainly they are responsible for the maintenance of the osmotic pressure of the plasma, and maintenance of this osmotic pressure. It provides movement of the fluid water from the between the vessels and between intercellular space, so to the tissues. And oncotic pressure is part of osmotic pressure. Also, maintaining of the circulatory blood volume, and it is related to the level of blood pressure. Determine the buffer reserves of blood plasma, regulating of myocardium and skeletal muscle contractile function. Microelements, copper, cobalt, iron, and others. So from part of the prosthetic groups of enzymes that catalyze biochemical reactions, and in general, mineral content is about 0.9% of the total plasma volume. Also, it includes plasma, includes substance of organic origin, so nitrogen containing products of protein catabolism, which generally called residual nitrogen. Violation of the kidney's excretory function can be diagnosed by increasing in the content of residual nitrogen. In case of the liver pathology, creatinine is more informative indicator. Plasma lipids are evaluated by the level of total cholesterol, low density, very low density, high density lipoproteins, and triglycerides. Also, coefficient of heterogeneity can be calculated by the equation. So low density, sum of low density lipoproteins and very low density lipoproteins divided by high density lipoproteins. Pigment metabolism is evaluated according to the indicators of total bilirubin and its fractions, direct and indirect. Increasing in these indices can be observed in case of blood system, hemolytic anemia, liver, or bile excretory system pathology. Enzymes such as alkaline phosphatase, alanine aminotransferase, aspartate aminotransferase, and G-glutamyl transferase are used for evaluation of the hepatobiliary system function. Glucose is a compulsory component of the biochemical blood sample, which is important in diagnosis of diabetes mellitus. Its concentration on empty stomach in healthy people ranges from 4.1 to 5.9 millimoles per liter. Also, hormones and vitamins are present in blood plasma. Physical and chemical properties of blood and plasma. First is osmotic pressure. It is created by the substances dissolved in it, and its value is determined by the concentration of all dissolved molecules and not by their size. Normal value for osmotic pressure 7.5 atmospheres or 280 to 300 milliosmoles per liter. The part of proteins in osmotic pressure is only 0.03 to 0.04 atmospheric or 25-30 millimeters of mercury column. This part of osmotic pressure is called oncotic pressure. And according to law of osmosis, so fluid moves from the lower concentration to the higher concentration. The same will happen between vessels and between tissues, where will be greater osmotic pressure. To that direction will move fluid. Also, according to the osmotic pressure of the solutions, they are divided into isotonic. These solutions have the same osmotic pressure as blood plasma, 0.9% solution of sodium chloride or 5% glucose solution. Hypertonic has higher osmotic pressure, hypotonic have lower osmotic pressure. If isotonic solution will be intravenously given to the patient, there will be no changes in osmotic pressure of blood plasma and no fluid movements. If hypertonic solution is given, then osmotic pressure of the blood plasma increases and fluid will move from the tissues to the vessels. If hypotonic solution is given, osmotic pressure will decreases in the blood plasma and fluid will move from the vessels to the tissues. Next parameter is osmotic resistance of erythrocytes, the resistance to the action of hypotonic solutions. Minimal osmotic resistance in the norm corresponds to 0.46% sodium chloride solution. Only the weakest erythrocytes are hemolyzed in such solution. Maximal osmotic resistance corresponds to 0.33% sodium chloride concentration, which causes complete hemolysis of all erythrocytes. Blood viscosity, next parameter, its ability to resist the flow of fluid particles moving relative to one another. Viscosity of the plasma is 1.5 to 1.8 and the whole blood viscosity is 3.5 to 5.5 units. One of the parameters which influence on the viscosity is hematocrit. The greater hematocrit, the greater will be blood viscosity and the greater will be overload on the heart because it will pump thicker blood. Colloid plasma stability associated with superficial negative charge of proteins, which is called Phi potential. Decreasing colloid plasma stability and aggregation of erythrocytes can be caused by decrease in concentration of albumins and increase in concentration of globulins. Measure of the suspension properties of the blood is erythrocyte sedimentation rate. Normally, it makes from 1 to 10 millimeters per hour in male and in female 2 to 15 millimeter per hour. And due to direct influence of the albumins and globulins on the colloid plasma stability, so changes in the relation between albumins and globulins means increase in the globulins. For example, in case of some inflammation process, there can be production of antibodies and increase in gamma globulins level. So it will lead to increase in the erythrocyte sedimentation rate. The same with fibrinogen. So first, formed elements of the blood are erythrocytes. They are flexible biconcave anucleated cells. They are formed from proerythroblast, then basophil erythroblast is formed, then goes polychromatophil erythroblast, then orthochromatic erythroblast, and reticulocytes is the direct precursor of erythrocytes. Reticulocytes are slightly immature red blood cells, normal value 0.5 to 1.5% in peripheral blood. After a lot of bleeding, move to a high altitude or certain types of anemia, there can be increase in the reticulocytes level. Mainly when there is excessive decrease in the level of erythrocytes. So red bone marrow does not have enough time to produce more erythrocytes, so it starts to release more reticulocytes to the peripheral blood, as it is slightly immature red blood cells. Main function is to carry oxygen. They have biconcave disc shape, essentially bags of hemoglobin. Some only few organelles are present. Anucleated means that mostly all content of erythrocyte is filled with the hemoglobin. Contain plasma membrane proteins, pectin, and other proteins. Major factor contributing to blood viscosity. The greater value for erythrocytes, the greater will be blood viscosity. So some character features for erythrocytes. So the glycoprotein membranes contain sialic acid, which dissociate and provides negative charge on the surface of erythrocytes when its membrane is damaged. Carbonic anhydrase catalyzes the formation of carbonic acid from carbon dioxide and water and reverse reaction. Anaerobic glycolysis, so the way of receiving energy. Glucose is also oxidized by pentose pathway, which results in the formation of 2,3-diphosphoglycerate, which change affinity of hemoglobin to oxygen. Possible other shapes of the erythrocytes, like spherocytosis. Spherocytes are smaller than normal red blood cells and lack central pallor. They are less deformable and less able to navigate through small vessels, leading to increased destruction in the spleen. Yes, so one of the type of heredity anemia spherocytosis. Cells with sickle cell anemia hemoglobin are stiff and sticky. When they lose their oxygen, they form into the shape of a sickle or crescent like the letter C. These cells stick together and can't easily move through the blood vessels. This can block small blood vessels and movement of healthy, normal oxygen-carrying blood. The blockage can cause pain. So here we will see normal blood, red blood cells. Now they can change their shape and move easily through the small vessels because the smallest vessels have the smallest vessels, they have smaller diameter than the size of erythrocytes. Due to this, they need to change their shape to move through them. And here we can see sickle cells, which block the small vessels. Hemoglobin is the main component of erythrocytes. So it makes from 130 to 160 grams per liter in male and 120 to 150 grams per liter in female. Oxygen capacity of hemoglobin, it's the maximal volume of oxygen which 1 gram of hemoglobin can bind. So 1.34 milliliter of oxygen can bind 1 gram of hemoglobin. And we can calculate oxygen capacity of the blood by multiplying the level of value of hemoglobin on 1.34 milliliters of oxygen. Color index is one of the parameters which can be calculated using the value of hemoglobin and value of erythrocytes, and it shows us so it can shows us changes which can help diagnose certain kind of anemias. So color index is from 0.85 to 1.05, average content of hemoglobin in one erythrocyte. Normochromic, in this case, color index is normal, and anemia, if there is present anemia, it is associated with internal disorders. Hypochromic anemia situation when color index in the blood is lowered and less than 0.85. It can usually be seen in case of iron deficiency anemias. Hyperchromic, when the color index of blood is greater than the established upper limit, 1.05, and it can be usually seen in case of B12 deficiency or folic acid deficiency anemia. Types of hemoglobin. So hemoglobin A, adult hemoglobin, and fetal hemoglobin F. Compounds of hemoglobin. So there are physiological compounds and pathological compounds. On the left side of the screen, we have physiological compounds. So it's oxyhemoglobin, compound of hemoglobin with oxygen, carb hemoglobin or carb aminohemoglobin, compound with carbon dioxide, and the oxyhemoglobin, so hemoglobin which already release oxygen to the tissues. Pathological compounds, so it's methemoglobin, in that case, two-valent ion becomes trivalent, and carboxyhemoglobin, it's compound with carbon monoxide. Metabolism of heme. So hemoglobin divides on heme and globin. Heme transforms to bilirubin. Bilirubin in the liver enters with the bile to the bile duct to the small intestine, and then goes to the large intestine in form of urobilinogen. It can be excreted with the kidneys together with urine, and in form of stercobilin can be excreted with the feces. Iron is important component of the hemoglobin. Iron involved in the formation and functioning of it. Most iron is found in hemoglobin, rest is stored as ferritin. Iron needs a protein called transferrin to travel in the blood. Ferritin is absorbed by macrophages and form amorphous insoluble aggregates called hemosiderin inside the lysosomes. The removal of ions from the depot is regulated by the hormone of the liver, which is called hepcidin. It blocks the membrane protein responsible for ions transferred from the cells. Normal value from the total iron 9 to 27 micromoles per liter. Also, erythrocytes on their surface contain antigens which provide and responsible for the blood grouping according to ABO system and RH factor. So, person can have presence of A antigen on erythrocyte surface, B antigen, or both A and B antigen, or no antigen. If on the surface of erythrocytes there is present A antigen, So the blood group refers to the type A. If B antigen is present, so it refers to type B. If both A and B are present, it refers to type AB. If no antigens are present, it refers to type O or 0. And if certain antigen is present on the surface of erythrocytes, then in blood serum there should be present opposite antibody. Means that in type A there is present anti-B antibody, in B type anti-A antibody, in AB type no antibodies, and in type O anti-A anti-B antibody. Opposite antibody should be present because in case of meeting of A antigen with A anti-A antibody or B antigen with anti-B antibody, there will be reaction of agglutination, which will lead to hemolysis of erythrocytes. The same with RH classification of the blood groups. So blood group can be Rh positive if the antigen is present on erythrocyte cell, or Rh negative if it is not present. And in case if the Rh positive blood will be transfused to the Rh negative person, so it will lead to formation of the antibodies against this Rh antigen. So hemolysis of erythrocytes is rupture of erythrocyte and release of its content into blood plasma. Also, regarding the Rh blood grouping, there is very important to remember about the case when there can be Rh conflict. It can occur, so it can occur during pregnancy if mother or pregnant woman is Rh negative, father is Rh positive, and child will be Rh positive. In this case, but not always during first pregnancy, usually during second or third pregnancy, or if the mother blood already immune system met with the Rh antigen, so can occur Rh conflict, which lead to hemolysis of erythrocytes and hemolytic disease of the newborn. Okay, next formed elements of the blood are leukocytes. They make from 4 to 10 in 10 per 9 per liter. They have nuclei and organelles, contractile proteins. They are divided on granulocytes. It's neutrophils, basophils, eosinophils, and agranulocytes, lymphocytes, and monocytes. They formed in bone marrow, thymus, lymphoid tissue, circulate in the blood for several hours, and then migrate to the connective tissue. Lifespan is very short, from 3 to 5 days. Comparing, for example, with erythrocytes, erythrocytes lifespan from 90 to 120 days. So, first type of leukocytes, neutrophils, they make 1.8 to 6.5 in 10 per 9 per liter. They make the majority of all leukocytes in the blood. Granules have an affinity to neutral dyes. Diameter is in average from 9 to 12 microns. Consist of young rod nuclear and segmental nuclear neutrophils. Bone marrow, so they are formed in bone marrow, then remain in blood for only 6 to 8 hours and migrate rapidly to the tissues. Phagocytosis, the foreign microorganism and tissue debris main function. So they are called microphages. They produce lysosome enzymes. Anaerobic glycolysis takes place in neutrophils, so they are able to perform their function in tissues with low oxygen content, such as, for example, inflammation place or edema. Also, so they are first cells which move to the place on invasion. They provide phagocytosis of everything, so of this pathogen, and after that they die, and pus is formed. So pus, it is consist of neutrophils and the residues. Due to this, in case of bacterial infection, there will be activation of neutrophils. They will provide phagocytosis and, as a result, formation of pus. Neutrophils in female have specific structures called drumsticks. Actually, they are round-shaped chromatin granules connected to the nucleus, and they are called bar body. Eosinophils from 0 to 0.5 in 10 per 9 per liter. Granules have affinity to acidic dyes. Quantity undergoes pronounced daily fluctuations. Diameter is about of 10 to 14 microns. Microphages. Phagocytic activity is less compared to neutrophils. Inactivation of factors responsible for the development of allergic and autoimmune reactions. Toxic effect on helminths and their larvae. Basophils from 0 to 0.2 in 10 per 9 per liter, diameter about 8 to 10 microns. Granules are prone to absorb the alkaline dyes. Granules contain such biologically active substances as heparin and histamine. Heparin is a substance that prevents blood clotting, and histamine has powerful vasodilatory action. Mainly, the basophils release histamine and heparin to provide greater blood flow and leukocytes flow to the place of invasion. Gamma globulin receptors are located on the surface of basophils, to which immunoglobulin E fraction of immunoglobulins can bind. So complex antigen antibody is fixed on the receptor of basophil membrane, and it causes release of histamine from granules, which can lead to typical allergic manifestations: skin redness, itching, and bronchial spasms sometimes. Lymphocytes make from 0.8 to 5 in 10 per 9 per liter after being released into the blood, can proliferate and differentiate. There are two large fractions of lymphocytes: T lymphocytes and B lymphocytes. T lymphocytes are formed in the thymus and B lymphocytes in the bone marrow. After leaving the place of maturation, they migrate into the secondary lymphoid organs: lymphoid nodes, spleen, lymphoid tissue of the stomach, intestine, pharyngeal tonsils. T lymphocytes are responsible for the cellular immunity. Depending on the specialization in the implementation of the immune response, there are three subtypes of T lymphocytes. It's T helper cells, T cytotoxic or killers, and T suppressors, which suppress the cellular and humoral immunity interactions. T lymphocytes make up 70 to 80% of all lymphocytes. Remaining part are B lymphocytes, responsible for humoral immunity. After antigenic stimulation, they are multiplying and mature into plasmacytes. They are capable of producing a large number of antigen-specific antibodies. From 1 to 5% lymphocytes do not have properties of neither T or B lymphocytes. They are considered a special fraction 0 lymphocytes. Their most probable function is destruction of cancer cells and infected by viruses cells. Natural killers, so specialize in the destruction of cancer cells and play important role in the innate immunity. They are somewhat larger than normal lymphocytes and contains granules with enzyme that damage membranes of the target cells and called perforin. So, together with the absolute values of leukocytes, also important to remember normal values in percents relative values, and percentage ratio of different forms of leukocytes in peripheral blood is called leukocyte formula or leukogram. So neutrophils juvenile normal is from 0 to 1%. Immature neutrophils 1 to 5%. Segmented old neutrophils 45 to 70. Eosinophils 1 to 5. Basophils 0 to 1. Lymphocytes 20 to 40. Monocytes 2 to 10. And in blood sample, usually you will receive both type of values in percents and also absolute values, and mainly the changes in one cell's level in percents will lead to corresponding changes in the other cells because totally they should make up 100%. And by the evaluation of the young neutrophils, which are juvenile and immature, and relation to the segmented neutrophils, we can talk about the shifting of the formula to the left or to the right. If there is greater amount of juvenile and immature neutrophils than normal values, and correspondingly there will be lower segmented levels, so it's shift to the left. It can be also shift to the right in case if there is increase in the number of segmented neutrophils. So shift to the left, most common cause is inflammation because inflammatory cytokines stimulate both neutrophils production and release of mature and immature forms from the bone marrow, increase leukoplasis in myeloid leukemia after considerable amount of blood loss and reflex reparation process in the red bone marrow. Shift to the right, chronic disease of the liver, kidneys, including megaloblastic anemia. So if we talk about this formula, so child is born with a ratio of neutrophils to lymphocytes like in adults. Followed next days, it begins to increase the percentage of lymphocytes and decrease percentage of neutrophils, become equal to 5 to 6 days of life. It's first crossing of the leukocyte formula. We talk about crossing of leukocyte formula when percentage of lymphocytes and neutrophils become equal. Number of lymphocytes increases after first crossing until 5 years of life and exceeds the relative content of neutrophils. Then at age of 5-6 years, second crossing of the leukocyte formula occurs. And after second crossing, leukocyte formula gradually acquires a form of the typical for adult. Also, there is one system in the body which together contain all or like so contain all cells which are capable of phagocytosis. Heterogeneous population of phagocytic cells in systemically fixed tissue that play important role in the clearance of particles and soluble substances in the circulation and tissue and forms part of the immune system. So it contains microglial cells produced in the nervous tissue of brain, pulmonary alveolar macrophages in lungs, tissue macrophages or histiocytes in connective tissue, Kupffer cells in the liver, macrophages in lymph nodes, osteoclasts in long bones, macrophages produced in spleen, and glomerular mesangial cells produced in kidneys. Functions of the reticuloendothelial system: phagocytosis, bacterial dead cells, foreign particles, processing antigen and antibody production, breaking down of aging red blood cells, and storage and circulation of iron. Lymphoid organs include thymus, a high rate of growth and activity until puberty, then begins to shrink its site of T cells maturation. Lymph nodes, small encapsulate bean-shaped organs stationed along lymphatic channels and large blood vessels of thoracic and abdominal cavities. Spleen structurally similar to lymph node, it filters circulating blood to remove worn out red blood cells and pathogens. Immune function of the spleen, so it directly connected to blood circulation, responds faster than other lymph nodes to blood-borne antigens, destruction and processing of antigens, reservoir of lymphocytes in white pulp, site for phagocytosis of bacteria and worn-out blood cells, site of B cells maturation into plasma cells, which synthesize antibodies in its white pulp and initiates humoral responses. Removes antibody-coated bacteria along with antibody-coated blood cells. Contains half of the body monocytes within the red pulp. Upon moving to the peripheral tissue, turn into dendritic cells and macrophages that promoting tissue healing. So phagocytosis stages, it is a process of innate non-specific immunity. So meeting with the pathogen, interaction with receptors, then phagocyte pathogen envelops, digestion of the pathogen. So here we have formation of phagosome, formation of phagolysosome, and after then pathogen breaks down into proteins and other molecules, and then antigen will be presented on the major histocompatibility complex and interact with the specific cells, that immune cells, which will provide response. If we talk about primary immune response, so pathogen meets with the macrophage, it provides digestion and presentation of the antigen on the major histocompatibility complex. And T lymphocytes interact with this major histocompatibility complex with the pathogen, and it starts to produce cytotoxic T cells, killer cells, which destroy infected body cells and also cause activation of B lymphocytes. And B lymphocytes proliferate to plasma cells and they start to produce antibodies to the certain antigen. Also, B lymphocytes transform some of them to memory cells, and means that when next time the same antigen will enter to the body, so it will directly interact with the B lymphocytes memory cells, which will start to produce antibodies. So there are 5 classes of antibodies. So main antibody of primary response best at fixing complement, monomer form of immunoglobulin M. It serves as the B cell receptor. Main blood antibody of secondary response with immunoglobulin G neutralizes toxins and responsible for opsonization. Immunoglobulin A secreted into mucus, tears, saliva, colostrum, and immunoglobulin E, antibody of allergy and antiparasitic activity, and immunoglobulin D is B cell receptor. They are gamma globulins. And last formed elements of the blood, thrombocytes. So they are fragments of megakaryocytes, do not have nucleus. Normal range from 180 to 320 in 10 per 9 per liter, circulation in blood from 8 to 12 days. The main function is to maintain hemostasis, also transport of biological active substances, trophic function for endothelium, immunity, clot retraction, procoagulation, effect and inflammation. Thrombopoiesis, platelets in bone marrow are formed by budging off from megakaryocyte large cell. Megakaryocyte and platelet production is regulated by thrombopoietin, hormone usually produced by the liver and kidneys. Each megakaryocyte produces between 5,000 to 10,000 platelets. Reserve platelets are stored in the spleen and are released when needed by sympathetically induced splenic contraction. Old platelets are destroyed by phagocytosis in the spleen and by Kupffer cells in the liver. Hemostasis is a process which causes bleeding to stop, meaning to keep blood within a damaged blood vessel. It is the first stage of wound healing. Most of the time, this includes blood changing from a liquid to solid state. Opposite of hemostasis is hemorrhagy. Hemostasis has three major steps: vasoconstriction, decrease in diameter of the vessel, temporary blockage of a break by platelet plaque, and blood coagulation or formation of a clot that seals the hole until tissues are repaired. Two types of hemostasis: vascular thrombocyte hemostasis, stoppage of the blood loss from the microcirculation with that have low blood pressure, and finally plate plaque is formed. In this case, the plaque will be formed only from the platelets, and due to this it will appear white in color, so it is also called white plaque. Coagulation hemostasis, stoppage of the blood loss from the large vessels having higher blood pressure, so blood clot is formed. In this case, there will be activation of coagulation cascade, which will lead to formation of the fibrin network, and this fibrin network will catch trapped formed elements of the blood, mainly erythrocytes. Due to this, it will appear red blood clot. Vascular thrombocyte hemostasis, vessel is injured, vasoconstriction due to nervous reflex occur, activation of von Willebrand factor, adherence of platelets to collagen, positive feedback. Platelets undergo shape change, release ADP and ATP, ionized calcium, serotonin, epinephrine, thromboxane A2 from granules, primary temporary platelet plaque is formed, and then stable permanent platelet plaque is formed. Cellular platelet clotting factors. Cellular clotting factors are presented in the granules of thrombocytes. These factors are released when the platelets undergone degranulation, so it's adenosine diphosphate, adenosine triphosphate, ionized calcium, serotonin, epinephrine, thromboxane A2. If activation of secondary coagulation hemostasis can occur by two pathways. So, extrinsic pathway activator is tissue thromboplastin. It activates transformation of the seventh factor to its active form. Then, seventh complex activates the tenth factor. Tenth factor, together with fifth complex, fifth activated factor, calcium and phospholipids, activate transformation of prothrombin to thrombin. Then thrombin provides transformation fibrinogen to fibrin, and by the action of the fibrin stabilizing factor, it transforms to fibrin network. Intrinsic pathway activator, collagen, glass, and others. So activation of the 12th factor, 11th factor, 9th factor, then together 8 complex provide activation of the 10th factor, and beginning from the 10th factor there will be the same sequence, means we have common pathway. Several stages of coagulatory hemostasis. Activation of prothrombin, activator prothrombin transformation to thrombin, then fibrinogen to fibrin monomer, fibrin polymer, cross-linked fibrin polymer. Significant stoppage of blood loss from the large vessels having higher blood pressure by formation of blood clot. Plasma clotting factors, so it's first one fibrinogen, second prothrombin, third one tissue factor, fourth one calcium ions, fifth one proaccelerin, sixth one is absent. So first one it was named, but then it was removed from the list, but the numeration of the list is saved. So we have fifth, then seventh one proconvertin, eighth one antihemophilic factor, ninth one Christmas factor, 10th one Stewart factor, 11th one plasma thromboplastin antecedent, and 12th one hegemon factor, and 13th one fibrin stabilizing factor. Fibrinolysis. So by the activation of Plasmin from plasminogen is factors such as factor 12 activated kallikrein, protein C plasminogen is transformed to plasmin. Then also streptokinase activates this. Plasmin is responsible for activation of the fibrin to fibrin degradation products. It can be inhibited by the plasminogen activator inhibitor transformation of plasminogen to plasmin, and also alpha-2 antiplasmin can inhibit action of plasmin on the fibrin. Fibrinolytic system function lysis of blood clots for a few days, clot destroyed by plasmin, which formed from plasminogen. This reaction is activated by blood and tissue activators. System of anticoagulation, pre-existing primary anticoagulants, natural heparin, antithrombin 3, artificial decoumarin, and palantan. Inactivate clotting factors. Factors helping the system of anticoagulation, so rapid blood flow, smoothness of endothelium, same charge on formed elements and walls of vessels, presence of glycoproteins and prostaglandins on its surface. So thank you for your attention.